Good day, my name is Dr. Julia Ambler. I work for a non-profit organisation based in Durban, KwaZulu-Natal, that's in South Africa. We're called Umduduzi, which in Zulu means the comforter, and our aim is to provide palliative care to children up to the age of 18 suffering from life-limiting and life-threatening conditions. Most of the children that we see are from very poor socio-economic background, and many of them are in fact Zulu speaking. So translation is quite a big issue for us, as I'm an English speaker with very limited Zulu skills. The diagnoses that we see range from all childhood cancers, brain tumours, leukemias, rhabdomyosarcomas, to complications of TB and HIV. We see a fair bit of chronic lung disease due to HIV and TB complications. We see a lot of cardiac conditions, inoperable heart problems, cardiomyopathies that are often due to unknown cause. And then of course lots of congenital abnormalities, trisomy 13 or 18, that require palliative care. One of our biggest challenges in South Africa is that palliative care is not actually a recognized speciality. It's really hard to integrate it into the local health system, and certainly there are no government posts available to be able to do this work. So all palliative care that happens in South Africa is in the NGO sector, which usually comes with issues around funding and governance. The main gaps that we have in our particular service are that we're a very small team. Our organisation in Durban is a social worker and myself, who is a doctor, and we really need more staff. We need to find a way to be able to expand our team, and we could only do this either by integrating into government services or by finding the funding to be able to employ more people to offer the services that we provide. Our greatest issue at the moment really is the funding. We are seeking to and have meetings with local government departments, particularly the health department, trying to get them to provide posts in palliative care, but as it's not a recognised specialty, I think this is some way off, and it's something we're going to need to continue working on in the future. Just in terms of where we aspire to be, I think is exactly that we want to find a way to integrate paediatric palliative care and adult palliative care into what is already being offered by the state hospitals. I think if I had one thing to say to the rest of the world, it would be that in a country like South Africa, we have so much, we have so many facilities, and we are able to treat many different conditions because actually our tertiary hospitals are pretty good and we have funding. We're not that under-resourced relatively, but we still have enormous issues of an under 5 mortality rate that is much higher than it should be for a country with our economic background. And it's really hard to prioritize pediatric palliative care and to get other people to see that we need this as a specialty, that it should be part of undergraduate and postgraduate curriculum, that it should be something that we're offering to children when we've got so many children that are dying from conditions that are absolutely preventable. So I think in South Africa we've got lots and lots of challenges, but we're also doing amazing work, and that work has already begun. Thank you.